We have about 1 in 5 Americans seeking mental health services at this time. There are just not enough therapists or providers of any other nature who can provide services to this whole big community. So we really need to adapt and build better care models so that we can reach a broader swath of our community. Prior to COVID, there were many barriers in providing telepsychiatry care. I think the biggest one, though, was from the providers feeling comfortable that this will be as effective as in-person care. That changed overnight, and we saw mental health care appointments actually skyrocket during the pandemic, while other healthcare services, saw a decrease in volume. And we were able to do that because we adapted technology. Not only was it safe, people found it engaging, and it provided treatment to our patients at a time of significant need. It became a catalyst that disrupted how we provide care overnight. So telepsychiatry services are here to stay. The regulators realized the benefit of providing treatment through use of video conferencing. Before COVID, Medicare and Medicaid restricted where we could provide telepsychiatry to which kind of consumers in which geography. Now that also changed overnight with the declaration of public health emergency. So we were able to reach a lot more individuals. And even though the public health emergency is now ending, we are going to be able to continue to enjoy some of that regulatory relief that we got. And we couldn't be happier about that as providers and as consumers of mental health care. Another way to expand services is using mental health apps. There are now 10 to 20,000 apps that one can download. There are apps that are really helping with the workforce situation. So they're connecting patients with therapists who may be in a different part of the country or may have a unique specialty that is needed to treat that specific disease. So they're disrupting how we are thinking about providing treatment traditionally in a brick and mortar space is now being available in a virtual environment. I think people still like the human touch. They don't mind using technology to get to a human. It makes it easier. They can access treatment wherever they are. Applications that provide services for decreasing anxiety or meditation or helping you calm down are working in a what we call subclinical space. They're trying to treat people who are not clinically that severe that they would be needing psychotherapy or medication management. It's rapidly changing, the technology. While it's changing, the research is really lagging behind. So we just need very high quality research to identify products that really work. The system will have to evolve to figure out how to pay for these applications, because in the end, it's just going to help everybody. It's going to make treatment as a whole cheaper and increase the access for our communities.